I'm Andrea Flores. Here at CBSN Denver, we are committed to bringing you all of the latest coronavirus information. We also want to bring it to you with as much context as possible. That's why every week we get your coronavirus questions answered by a doctor during a special segment called Q&A with Dr. Dave. Joining me now is CBS 4 medical editor Dr. Dave Hnida. And Dr. Dave, many airlines are taking precautions in order to protect passengers. Still, how risky would you say it is to fly right now?
I think at this point, there still is a degree of risk involved, something that you really need to take into account, despite the fact that airlines are saying, well, we are taking extraordinary measures in order to keep you safe. If you've seen some of the pictures that have gotten out about how planes are being filled up, folks are basically sitting shoulder to shoulder in full airplanes as fewer flights are being utilized in order to get people around the country. So in terms of social distancing, it's just not happening. Everyone is required to wear a mask while flying, but when you look at some of the pictures that are coming from airline passengers, not only are people squished together, but it's a situation where masks are often not being used properly. In other words, you have people who are sitting with masks that are below their noses. Some people had their masks down below their chins. And so you are exposed to others potentially, despite all this good hygiene that's otherwise being done. You are in an enclosed cabin and you are with these folks for an extended period of time during a flight. So I think there's going to need to be quite a bit more tweaking before you can say, well, I can fly and we're good to go.
Bars and stadiums seem like they may be the last places that open up during this pandemic. Why is that?
Well, when you think about places like bars, it is a place that typically you go to, people are crowded together, no one is socially distancing, nobody's wearing a mask. I mean, after all, you're having a cocktail or a beer or something, and you're getting together to have a good time. And so it's a place where spread is certainly going to be much more possible than in another setting. Right now, they're talking about, well, people could use open patios, for example. But what happens when the weather changes? I think that's going to wind up being an issue because you'll be bringing people back inside again into a very enclosed place with typically poor air circulation, and they're going to be there for more than 15 minutes or so. So bars are going to be especially challenging, just as it is for restaurants. When it comes to going to a stadium or some sort of arena, that's a good question too. But in many ways, especially if you take a look at something like the Broncos, the risk is probably less than going to a game and watching the Broncos on TV at, say, a sports bar. So a lot of questions here about just what exactly is going to be a safe way to go about this and why there is such caution and such delay in terms of opening up all of these types of venues.
Wearing masks has become the new normal. Could wearing a mask for a long period of time lower someone's oxygen and put them at risk?
I think at this point in time, this is something that is circulating around by people who really don't want to wear masks for one reason or another. And this is something where people are saying, well, if you're wearing a mask and you're covering your face, what happens is you don't get enough oxygen in, and you're also blocking carbon dioxide, which is normally something that you exhale, and if it builds up in your bloodstream, makes you kind of drowsy and in alert. You need to kind of go backwards and think about something. In hospitals, staff wear masks for 12 hours at a time. I go in and I do surgery. I've worn a mask for 6 hours at a time. And that's because things like oxygen and so forth, they actually are small enough, much, much smaller than viral particles, and are easily able to get in and through a mask. So you're not at risk from having sort of lack of oxygen.
Many people think of coughing and sneezing as some of the obvious ways COVID-19 can spread, but how does something like talking spread the virus?
It's really kind of interesting because somebody did a study on this just to get an idea of just what common everyday talking will wind up doing in terms of spreading the virus. And what winds up happening is when you talk with somebody, you wind up putting out more than 2,000 particles every minute of potentially coronavirus. And so these particles can stay in the air for up to 14 minutes. Now, you'll say, well, that's kind of scary sounding, but the good news is that the particles do tend to drop off to the ground because of their weight, even though they're microscopic, by the time you get to 5 or 6 feet. Hence, the reason for the 6 feet social distancing. And so when you wind up looking at the fact that we're being asked to wear masks, we're also being asked to socially distance, the idea that doing that will protect you is certainly valid, even with simple coughing, not just with sneezing and not with coughing.
And thank you, Dr. Dave, for all of that helpful information. We'll see you back here next Monday at 11 a.m. as we answer more coronavirus questions. And to see all of our Q&A with Dr. Dave segments, just head to cbsdenver.com. We'll be right back.